Heading into fall, and COVID-19 is having less of an impact. But Thursday, Washington state health officials were far from ready to call the pandemic over.
While the emergency phase of COVID-19 may be ending, we know that COVID-19 is still very much with us in our state.
Washington Health Secretary Dr. Umair Shah said hospitalizations are down, with COVID patients taking up 7% of hospital beds today compared to 11% a month ago.
But there are still some 300 Americans who are dying from COVID-related disease every single day, and that amounts to some 2,000 Americans a week. So we want to remind people to continue to be smart.
Washington's COVID state of emergency is set to end October 31st. That deadline does not mean it is time to let down our guards, though, despite much of our day-to-day looking pretty normal.
This year, people are more active and mobile. Many adults are working in person again, and children are back in school. This really creates opportunities for respiratory illnesses like the flu to spread.
In fact, health officials today urged everyone 6 months and older to get a flu shot because the flu season is expected to be much worse than the past 2 years. And getting the latest COVID booster can happen on the same trip to the doctor or pharmacy.
Absolutely. I'll be working through the winter and seeing patients and also asking everyone to get vaccinated. It's so important.
The other big part of prevention is still masking. Mask rules remain in place for healthcare settings and prisons in Washington. And while officials are looking at that, it's not likely it will end October 31st. In fact, the mask message, including the state's namesake, remains on the wall behind Dr. Shah.
Yeah, thanks, Tim. And I'm glad you noticed George Washington is wearing a mask. And as over the last couple of years, he was wearing it all the time, and now he's wearing it appropriately.
The state health secretary says it remains a good idea for anyone in a crowded situation, especially indoors, to have a mask handy and consider using it. Tim Gordon, KGW News.